Hello, I'm Dr. Bang Jisung, the hair wizard here to protect your hair. It's good to see you all. Today we're going to take a detailed look at your 1-month recovery progress. At the 1-month mark, the most common questions are, I've lost a lot of hair, is that okay? Also, patients often describe the transplant area as looking a bit red, or as if hair is sprouting, or just generally messy. So if you look closely, you'll see some areas that are smooth and others that appear a bit reddish. And there are areas where you can see thin hairs beginning to sprout, but it totally lacks symmetry and uniformity. Consequently, it's quite common for the scalp to appear somewhat messy and unsightly, almost like an inflammatory scalp condition. So I tell them to just shampoo diligently and gently rub the area. Particularly in those spots where you feel there's a significant increase in sebum secretion, you'll often see small, pimple-like bumps starting to appear. So patients often get worried saying, I'm shampooing diligently, doing everything the clinic told me, but all the implanted hair is falling out and now I have an inflammatory scalp. But most of the time, it's absolutely fine, so don't worry. This is all part of the process. Like I said, the scalp looks a bit chaotic because it's preparing for new hair to form underneath and grow out again. I just describe it as looking quite disheveled. So if you look at the photo, you might notice some shading or even fine hairs beginning to sprout on both the right and left sides. That's what it looks like at the 1-month mark. Just consider this normal. Sometimes one area might have grown in quite well, appearing fine, while another part might actually look even redder. Those whose redness subsides faster tend to show quicker progress in their recovery. As I mentioned, it's due to the quicker inflammatory response. Your real concern is the back of your head. The back of your head, the occipital region. For us, that's where we performed the hair harvesting, and because we often need to shorten the hair for that, you might worry about how conspicuous it will appear, but in truth it's hardly noticeable at all. After about a month, when you visit a hair salon, your stylist might ask, oh, did you have a procedure done in this area, perhaps with thinning shears or something similar? However, other individuals observing you generally won't perceive that you have missing hair. Conversely, if it gets too dry or if shampooing isn't done properly, you may experience a stinging sensation within the scalp. When you observe those regions, it's quite common to see scabs and dead skin cells. So, if you gently massage and shampoo the back of your head at the 1-month mark, it will actually improve much faster. You really don't need to worry. At 1 month, the front looks a little chaotic and the back is not noticeable at all. That's what you look like 1 month after surgery. Today, I've given you a brief overview of the 1-month recovery. I think looking at the photos will help you understand it well. Thank you.